Can you hear me now?
Yes, welcome. We have
Okay.
the full house right now. Thank you for bearing with us, everyone, as we try to navigate the hurdles of technology. So I'm going to go ahead and get started. Thank you, Dr. Sam, for being with us, and
Thank
Kate.
you.
So welcome, everyone. For those of you who don't know me, we have about 21 of you right now. We're expecting about 40 people to join us today. So my name is Beza Gabrihana. I am the program manager for Montgomery Hospice and Prince George's Hospice Center for Learning. We are really happy you can join us for the part 3 of our community dialogue webinar series on how COVID-19 is impacting communities of color. We have, for the past couple of months, we have addressed how COVID has affected the African American community. We've also done a webinar on how it has impacted the Hispanic community. So this is our last one in this series, in which we're going to discuss how it has affected the Asian American community, and then we would open it up to discussion. So throughout the webinar, I really encourage you to continue to ask your questions. You can do so by typing it in the chat box. When you type your questions in the chat box, be sure the send to is set to all panelists and attendees. That way we can all see your questions. So without further ado, I'm going to go ahead and introduce our panelists. It is my pleasure to have Dr. Sam McCurdy. I'm sorry if
Mukherjee.
McCurdy. And Kate Liu here with us. Dr. Sam is a retired multinational executive and scientist by profession. In the post-retirement, he switched to study financial planning and subsequently retired again as a director of a major multinational financial service company. He's also the board member and executive director of the Asian American Community Service. He's also a founding member of AICS. So it's really a pleasure to have him here with us. We also have Kate Liu, who is a licensed social worker at CCACC, which is the Chinese Cultural and Community Service Center. And she's been with the CCACC since 2011. She's also the clinical director at the CCACC Pan-Asian Volunteer Health Clinic. So it really is a pleasure to have you both to discuss how COVID is impacting communities of color. So to begin with, Dr. Sam, I'm going to start with you. Can you tell us a little bit about the Asian American Intercommunity Service and what you do? And then tell us how some of the challenges you're facing because of COVID-19.
Okay, a pleasure to meet all of you. This is Sam Mukherjee. Now, the programs that AICS have, we've been doing for 15 years, and it's been a dynamic journey. Moved ahead from small things to currently addressing the response to COVID-19 emergency program. So I'll jump straight to the COVID situation instead of wasting time on describing too much other stuff. This virus doesn't choose between you and me, though we know that certain people with underlying conditions for different reasons have been affected more. But there are a few salient things which stand out more than others. In general, I think it's across communities and ethnic barriers. The effects like the housing, socioeconomic issues, etc., all those are there. But we who are focusing more on the healthcare side, what we have identified is people who have chronic symptoms, and mostly the senior citizen category, suffering from chronic heart issues, cancer, diabetes, chronic management of pain, these are flaring out of control. And due to all the other changed social determinants that we have now, depression is a result that is coming out of all this. Depression by itself doesn't is not born as a depression, but depression is a result of other things that are happening. And the number of anecdotal evidence we have today, it's dramatically increased over the past 2 months. AICS has its plan for depression counseling through our certified counselors. We use the Pearl system, and this is a very uh, in-depth one-on-one counseling and the chronic symptoms too. Now, the challenge all healthcare providers are going to face now and are facing is traditionally what do we do to take healthcare to the community? We reach out. How do you reach out? Most of it is one-on-one, group setting, and etc. That is gone for now. So the alternative is transitioning everything to the telehealth platform. And here I will just distinguish between two words which people confuse a lot. Telehealth and telemedicine, they are not exactly the same thing. They can complement each other, they can migrate to each other, but they are not the same thing. Most of the service providers like us to the community, we are transitioning to the telehealth platform. Telemedicine deals directly with symptoms of a person and is between one provider and one patient at a time. Telehealth is different. Telehealth you can use for meetings, you can use for training, you can for data storage, you can use that as a multi-phase interfacing with several things, starting from patient information to provider, and in certain cases like us, we can interface with CMS. So this is something new that has come up. And as far as AICS is concerned, I can tell you we have put all our resources into developing and transitioning into the telehealth platform. And we are like everybody else, we are challenged. The biggest problem is outreach today. The methodology, the techniques, these are changing and we all have to adapt to that. One aspect of this telehealth transition is who is your target population? These people may not be all computer savvy. So what do? So we have a secondary program. You educate these people first, soften them up, make them more comfortable so that you can interact through the telehealth platform. All right, I wouldn't go on longer. I'll stop here and let others go on.
Yeah, so I think you touched on some important things, Dr. Sam, and including, I think you touched on depression and how you saw a hike in the case numbers that you were seeing. So how has the transition from face-to-face services to telehealth has it been easier? Are you seeing more people are now utilizing your services during the past couple of months than ever?
This is a very big challenge, and we are just in the beginning of it. So almost every day we are learning something. Of these, we found, and we knew these things, culturally competent approaches, like culturally and socially adequate or appropriate language. That helps more than anything else, because your key to success in these things is create trust, especially when you can't see somebody. When you can create trust, you can go ahead.
Right. That's very important. So on that note, Kate, how do you see, how did the COVID-19 impact the Chinese American community? I think you work predominantly with the Chinese community. How have what kind of impacts have you seen in terms of infection rates and mortality rates?
Yeah, so I actually work from a clinic, Montgomery Care Safety Net Clinic. So we are still going on, like I just mentioned, half day I'm still going to the clinic. The other half, I go home and have some webinar or meetings in the afternoon and weekend. So I can talk from what I see from the patient population, as well as the patient that CCACC serve. Also, the other thing is that we offer two hotlines. One is a COVID information hotline for everybody to call in as long as they have a question regarding medical question or just anxiety, mental health issue, they all can call in. So the other hotline is we offer assistance for grant information, grant application. So you know, there's so many programs out there and it's hard to figure out which one would work for me. So we have a team to help people through the process. So in that sense, we have a bigger reach of the population.
Mm-hmm.
So I can talk about what I can see from this interaction. I cannot represent the whole community.
Okay.
Yeah, so of course, like Sam said, it's a lot of change. I think it's profound change that would like last for a long time. And as a social worker, I actually embrace change. I see positive things in this. One thing would be a change of the way we serve people. So we also do medicine and mental health as a clinic, and both the patient and the physician love it. I mean, they figure out the way they figure out the way to use this remote application and reach the goal. But we do have patients that really cannot navigate that. So the target population we serve is low income and uninsured. And their need is huge, and what they have, the resource is very limited. So we still maintain some slot for them to come in if they have to. Of course, we have a screening process to make sure our staff is safe and the patient is safe. So, but we still keep that door open. But like I said, in this situation, I do see opportunity as telehealth, and I think it's actually easier for mental health service via telehealth, because it's been I think it's been a barrier. We also, I mean, in the clinic in the normal days, we do have limited mental health outpatient service, and sometimes to coming up to the clinic and present there, it's a barrier. People has to walk through that barrier to really go to the clinic. But if we set up a telehealth with face-to-face, just the provider and the patient, I feel that the patient are like they welcome this change.
That's interesting because like just like hospice, mental health is, I think, something that's stigmatized, and specifically even in the Asian American community, we see they're less likely. I think Dr. Sam, when we were chatting yesterday, you mentioned that there is already, it's an uphill battle to get to do outreach when it comes to both end of life and mental health. So this current situation has put us in a place of where those both needs are necessary. So with that said, how are you approaching conversations about end of life care with clients, Kate?
So I have the mindset that we have to keep this conversation along the way. So whenever an opportunity jump up, we just like mention it kind of casually. So one example would be when I work with seniors along the way, and things happen to them, and they want to, like the senior in the adult daycare center, they mentioned something, someone passed away just near them, maybe at the adult daycare center who next to them, then it would be an appropriate conversation to ask, if it happened to you, what would you want your family to deal with it? So bring that conversation back home at the dinner table. Ask very casually, something happened in the center to my friend, and if it happened to me, I would like to So it's not really, I think that at the hospice stage, we bring this up. There's so many things going on, right? It's really very tough. I mean, if that's the first time they encounter this conversation. So, so I always think that I think with all the healthcare provider, I think Medicare in the building question, I mean, annual checkup, they ask this question too. So I think that's a positive change.
Okay, that's great. So another thing that I wanted to ask was, so according to the state data, if we're looking at the state data, the Asian American community has one of the lowest COVID cases and death rates in Maryland. I think last time I checked, it was off of the 14,000 positive cases, only 900 of them were from the Asian American community. So what do you think are some factors that contributed to the lower infection and mortality rates? And either one of you can address that question.
So I jump in. I think that's a little different. I think the infections rate is lower, but the death rate is not much lower. I mean, it's pretty close to the mainstream. So that actually tells us some information that for infection, I think people are making a lot of precaution in terms of not to get it. Mm-hmm. So the reason for that is we have a longer education, public health education on COVID, because it happened in China first, right? Mm-hmm. So for about 2 months, then it comes to the US. So people watch what's going on in home country, and they apply, they learn about the virus and how it infects people and take precaution early on. Mm. And the other part of it, I would think, is the social determinant. Like Sam said, many people, they're lucky enough to live in a housing situation that is more spread out. Mm-hmm. So I think that would be another thing. And I think the to the first point is that the precaution, I want to mention about the face mask use. So yeah, so people are very taking precaution and make the protection in place early on. So I think that's helping.
That's great. So how with that, how are you with PPEs? So mm-hmm. Do you have enough PPEs for your clients, patients? Can you talk about that a little bit more?
Yeah. Yes. Okay. Go ahead.
Sorry.
Go ahead, Kate. I'll talk after you.
Okay. So for us, like I said, we are aware of this situation early on, and actually at the beginning of the outbreak in China, PPE is also a huge problem in China. So when it comes to us, we know we're gonna need it. So actually in January, CCACC has placed order from online seller from China. So we have a lot of face masks on the way. And then at that time, the adult daycare center is still open. So we make sure all the senior has a face mask. So that's why we have some stock for facial masks. Mm-hmm. And later on, they were sent home. It's not safe to open the center anymore. And then we have supplies, and then we would like to donate them to the community organization who needs them. So we've been doing that, and I'm really happy that we are in a position that we can lend out helping hands.
Great, and we were Montgomery Hospice was benefited from that generosity, and I do want to say that right here. Dr. Sam, yeah. Do you have more to add on that on PPEs?
Yes, on the PPE, we realized right at the beginning that masks were necessary and masks were hard to get. So we took up a mask project, and that has been a smashing success. Every day we are donating a couple of 100 masks all around to most of the assisted care livings, nursing homes, seniors living centers, hospitals, healthcare centers, pharmacies, etc. Just today we donated 100 masks to the Visiting Angels in Gettysburg.
Oh, wow.
It's going on every day. And it's been really overwhelming and emotional how people from the community who were not our members, they just came to know through social media, and they have a sewing machine at home, and they said, we have a machine, let us join. And like that, it went from 5 people to over 50 people now making it every day at home and supplying.
That's amazing. And
Now, about PPE medical grade, uh, we imported some from China. And those we imported those to be the medical grade, the N95 type, and we donated those to the real frontline people who are facing the patients. Now, when you talk of China, I just want to say something over here. There's been a lot of hate crimes going on, less in Maryland, more in some other places.
mhm.
But in Montgomery County, the police said there are not many official reports reported to the police, but we are hearing a lot. We are hearing quite a lot. And we have seen so much on the social media that AIC has developed and produced a video clip, anti-hate crime, just about 2 minutes, and many of you have got it. Please have a look at it. Hate crimes are going to increase once the emergency goes away. So
Yes. And
please be careful.
and I'm so glad you touched on that, because my next question was going to be on exactly that topic, which is, with the latest uptick in racism fueled by the pandemic itself, does the current rhetoric influence how Asian Americans approach healthcare in general, or seeking even help from the medical world? Either one. Do you think that this would have an influence as to whether they're going to seek end-of-life care, or even just to seek out help from the medical system, especially given how the group that both of your organizations serve predominantly focus on underserved and hard-to-reach groups? So does the current rhetoric add on to the barriers of seeking mental health services or end-of-life care services? Do you foresee that happening?
I do see.
Go ahead.
Yeah, so I do see hesitation of going out to seek help in times like this, and actually, I think the Asian community, it's been overlooked for a long time, and it has become a habit, I think. So now when this happened, all of a sudden we are on the spotlight. And yeah, so I think, I do see some change in terms like for the grant application program. I think if you are a person who lack the language and then the knowledge to navigate the system, you're going to have a hard time trying to figure out what kind of assistance you're able to get. And but I mean, other community, they maybe already have a system set up, and then they can get access to the help. So so I mean, in that sense, I do worry about some of the patients we serve. They are very vulnerable, and I mean, honestly, even from a clinic's perspective, I don't see them. I mean, I only see them when they are sick, really sick, and at this time they also avoid to coming to the clinic too. So yeah. Mm-hmm.
So you're already seeing some of the effects of it happening in your community, at least.
Yes, huge.
Okay.
I think across the board is that in the healthcare setting, a clinic setting, people are avoiding going to the clinic, so they don't seek preventive health care management. They just come for urgent needs. And so not to mention about all the great practice we've been put in place to keep their health managed under control. Those are not happening.
We have a question from one of our participants here who asked, I have an Asian American patient saying they don't call ambulance because of shame and don't want neighbors to know they might have COVID. They also discussed shame in terms of not wanting to apply for available and much needed COVID programs and resources. How can I best help these patients in culturally sensitive way? Good question. So, Dr. Sam, would you like to address that question?
Yes. Obviously, the stigma factor is really overshadowing all this, together with the cultural sensitivity that is always there, but is enhanced right now. I think the best way would be refer the person to an organization like KATES, CCACC, if they're Chinese or Chinese speaking, or to another one which is appropriate, so that the community health workers can start a dialogue, human to human dialogue. I think that is the starting point to soften up the people and open up and seek more assistance very openly.
I agree. Kate, do you want to add on that?
Yeah, so I actually have a situation like that, exactly like that.
Mm-hmm.
So for the adult daycare center, we send a senior home, and then we are required to call them every day to make sure they're fine. And from time to time, we know that a senior just have a fall during the night, and they don't call. They have the alarm. They can call 911, and they hold on until we call them, and instruct them what to do. It's very sad. It's really disheartening situation. So so I think when I noticed that when we have program in the county, oftentimes they try to create a whole program on their own, and maybe not keeping this community agency in mind. Maybe we can partner together because we already have a relationship with them. We know how to reach out to them. And on the other hand, we need resource to keep us going so that we can build a bridge. So I noticed there's a question later on, how do we do better? I think it's collaboration and knowing what we do. I mean, what each agency do in what capacity, and then we build on that instead of like just create a new program all a sudden, and then you have to rebuild the relationship. You have to let people know what you're doing, and so it's I do see a lot of things happening in that direction, and I think we can do a better job.
That's and I cannot state it well better than that. Basically, I think collaboration, definitely education is key. And this is why we're, definitely putting these webinars together, is that to bring that awareness. And with that said, I do want to end. We are at that mark at 12:30, but I have one question. What are some things we can do to support the Asian American community during these times? So what can we do to be of a support to that community? I'll start with you, Dr. Sam.
Okay. We know the negative impacts that all that happened and what we have been discussing. Now, I'll go back to the basic theme of where is the target population, who is the target population, how you get to them. And we know the current barriers, but one of the ways we are seeing is like to educate them. And how do you do them? You don't go and get them in front of you nowadays. One way we are finding a little easier, because most faith-based organizations, churches, temples, mosques, they have already set up very successfully a communication channel with their whole group of followers. So what we have started doing now is educating the priest and pastor, etc., so that they understand what we want to do and the importance of it, and through them passing on the message. And when time permits, if they give us a time slot, we can also have the opportunity of directly addressing a group. So that way, what the end game is that we will have access to these people, and they will feel more free to get their needs addressed.
Thank you. And Kate, I think that's definitely good. Yeah.
Yeah, so I think what we are doing now, just dedicate some time and space for the community to talk about what they need and voice out the situation. I think it's very, very helpful.
Time. Okay. I think I'm gonna go ahead and end it on that. I want to thank you both for giving us your time to share your thoughts and wisdom on this topic. If you have any questions right now is your opportunity to go ahead and type it in the chat box. If not, I'm gonna let my colleague is right now sharing an evaluation link. If you can just take a moment to complete an eval to let us know how you thought about this program, or if you have any suggestions as to what we should address next, it's your opportunity to do that. This is part of a 3-part series. As I said, if you missed the first 2 discussions, they are phenomenal, just like this one. I recommend that you go back and listen to them. They are all available on our YouTube channel, and I'll share the links to both of them in my follow-up. I want to thank you all for joining us this afternoon, and I hope you have a wonderful day. Thank you both for being here with us.
Thank you.
Thank you. Thank you.